Athlete Neurology video series, let's discuss pseudotumor cerebri, or also called as benign intracranial hypertension. Nowadays, the appropriate name is idiopathic intracranial hypertension, or IIH. So what is the condition? It is a condition which usually happens in younger, overweight or obese women typically, and the presenting symptom is a constant headache. So these patients have a headache which just doesn't go away. It's unlike a migraine where you get nausea and sensitive to light, sensitive to noise. This headache is just constant. Could be throbbing, could be pressure, and you also get as TVOs, or transient visual obscurations. That is just sudden loss of vision when the patient coughs or bends forward. Doesn't have to occur though. The main common complaint is just a constant severe headache in somebody who's younger, overweight. So if you see someone with that type of body habitus and age, and especially a woman, you got to consider that condition. Now, how do you diagnose it? The only way really to diagnose it is to do a lumbar puncture and see if the cerebrospinal fluid pressure is elevated, because that's what really causes the problem. It's the cerebrospinal fluid pressure is elevated because of excess production of spinal fluid for some reason. We don't know why it happens, but there's excess production of spinal fluid and elevated pressure causing this condition. And the other way really to look is to see if they have papilledema, which is increased pressure in their eye when you look through a fundoscope. Typically done by an optometrist and ophthalmologist after dilating the eye, the best way to look for papilledema. So if you see papilledema, that also very strongly points to the condition, but really the way to absolutely diagnose is to do a lumbar puncture and just to see if the opening pressure in the spinal fluid is high. And that's also the treatment really, because what you have to do is, if the opening pressure is high, you have to drain the spinal fluid, about 30 to 50 cc's of spinal fluid, and that straight away lowers the pressure. And then you also check the closing pressure, and that helps considerably in helping the symptoms. The patient immediately feels better, and that can usually last maybe from 3 to 6 months, and then the pressure builds back up, so you got to do the lumbar puncture again. So unfortunately, the treatment is serial lumbar punctures, and trying to lose weight can greatly help. Rarely are shunts needed. A ventriculoperitoneal shunt or VP shunt is needed if the lumbar puncture is not helping, and especially if the eyes are suffering permanent damage. Then VP shunt is rarely done though, but often just the lumbar punctures are enough, along with weight loss. We can also use medicines to reduce the production of spinal fluid, like acetazolamide, a brand name Diamox. Topiramate can also be used for this, otherwise known as Topamax. The advantage of Topamax, it also treats migraine headaches, which can be concomitant with this condition. Diamox is probably a better carbonic anhydrase inhibitor though, to reduce the production of spinal fluid. Sometimes the patient even has to undergo weight loss surgery procedures, but that is rare.